Welcome to Style with Trish. My guest today is Dr. Devonna Anderson, and today we're going to be talking about our health. Stay tuned.
Every day a woman reigns. It's time to live your dreams. Nothing's gonna stop you now. Keep going, keep going, keep going. Every day a woman reigns. Every day a woman reigns.
Welcome to Style with Trish. Today my guest is a childhood friend and family, none other than Dr. Devonna Anderson. She's here to share some medical tips in particular areas that I find very interesting, and I'm so glad to have her here on Style with Trish. So help me welcome Dr. Devonna Anderson. Welcome to Style with Trish.
Thank you, Trish. I'm glad to be here.
You know, we grew up together, so this is like family talking right about now.
It is. It's been a while.
Yes, one of the things that we knew growing up together, you always wanted to be a doctor. I can't even remember how young we were when you talked about being a doctor. How did you know, if you can go back that far, how did you know that was specifically the area that you wanted to go into? What was it about that profession for you?
You know, I get asked that question a lot. And my whole thing growing up was I was good academically. So I always wanted to do something that was challenging to me. And so at some point, I was between being an engineer and being a physician because I was like, those are the hardest things that I could think of.
Right.
And I didn't want to be an attorney. That was just out.
Yeah.
But when it came to medicine, it was just the fact that I could find a useful way to help people. And just basically the challenge of it academically and also being able to help people. Those
Yeah.
are the main things. And I don't even know how I even settled on it. I just know by high school, I was between medicine and engineering. I did a co-op, like an internship with General Motors, and that wasn't it.
Say no.
With medicine, there are so many options. You can go into so many fields, work in
Yeah.
so many areas. And the flexibility and the security of a job. So my parents worked at a plant. And so there was always strike year, you're gonna
Layoffs.
be laid off. I didn't want to do that. I wanted security. And so that was another thing.
Yeah, that's good, because it was like you were unlike a lot of young people. You knew what you wanted to do, and you actually did and walked out what it was that you wanted to do. If you don't mind, share your collegiate background. Like, where did you go to school?
So I went to Fisk University, HBCU, y'all. First generation. So there were a couple other people that went to college in my family. Actually, one uncle that went to college previous to me. So I went to Fisk University for my undergrad in Nashville, and then for medical school, I went to Wayne State University, which is a large medical school. Because it's so large and it's in Detroit, it also had a large class of African American students. So
Oh, wow.
it's a large, it has the second largest amount of African American medical students in the United States, even though
Wow.
it's a majority school. So it was good. So and then I went to residency in this mission-oriented program, Christian program in Oklahoma called In His Image.
Okay.
So I made my rounds.
Yeah, you did. And that's a lot of schooling. And you're still doing schooling. But what particular area did you settle on when it came to your own particular practice?
So do you remember that show Quincy?
Yes.
So I love Quincy. I loved Quincy when I was growing up. And so I was going to be a forensic pathologist.
Okay.
So because I like the investigations and things like that. But when I was in medical school, I went on a mission trip for the first time, and that was life-changing.
Yeah.
And, what can you do on a mission trip with forensic pathology? Nothing. I mean, that's dead people. I'm not dealing with dead people on a mission trip.
Right.
So I decided to go into family medicine as my primary specialty so I could treat a wide range of people versus, just one specific group of people. Or, one specific pathology. So Yep. So I went to family medicine as my primary. Then eventually, I've always treated obesity because of my background. I've struggled my weight. I used to be skinny mini. If you remember when I was young,
Yes, we both.
long legs, long arms, long neck. I was just long. And but over time I gained some weight, after having children and things like that. But my family struggles, everyone in in my family struggles, the women struggle with their weight. And so I've been around people who have been heavier my whole life. And so naturally I was drawn to the practice or the field of obesity because I wanted to help people in my family and people in my community, in our community, because it's an epidemic in our communities, more so than other communities. We have weight issues. So I was drawn to the field of obesity management. And so I was treating since I came out of school in 2005 or 2002, I finished medical school. 2005, I finished residency. So I've been doing obesity treatment since then.
Oh, wow.
Yeah. And then I finished my board certification. I got my board certification finally in 2000. I don't know. It was like maybe 4 years ago now.
Okay.
Yeah, it was about 4 years ago. So that's how I got into the obesity treatment. And then fast forward to last year, I decided to go ahead and get my addiction certification because addiction and obesity go together.
Yeah.
And I was I'm a medical director for a treatment facility called Bridges of Hope. And so, we are expanding. So I needed more expertise and I needed more credentials in order to satisfy the job requirements. So I decided to get my board certification in addiction medicine. So that's
where you are. That's amazing. I didn't know that you had the obesity certificate, or it's not certification. Is it certification? Okay, board certification. I didn't realize you had it that long.
No, I've had it like 4 years. I've been practicing with obesity management and obesity treatment since 2005. So I've been treating people, but without the certification, just learning on my own, from conferences and things like that. Then I got the board certification and I think it was 2017.
Okay.
So
we're going to spend a little bit more time in that particular area because that's the area that really strikes me as most important. But as someone who really since 2020 kind of let my appointments go as far as physicals and things like that. And I said for 2023, I'm going to get back on it. Before we go into our first break, kind of share the importance of all of us in going and making sure and keeping our health in check by way of physicals, at least annually.
Yes, I have so many people who say, well, I'm not sick. I don't need to go to the doctor. It's true, you may not be sick now, but you never know what's brewing inside of this body. There are so many changes that can happen just, literally within 6 months, I've had people come up with cancer, like breast cancer.
Yeah.
So the test that you go in for your annual screenings or to screen for these cancer, possibility of cancers, if you treat it early, most of them are like 99% curable. But if you wait until you have symptoms, cure rate is really low, 50% or less. So that's the reason we want to check these things and catch these things ahead of time before you have issues, before the treatment rate is really low.
And it's good just to be in a routine. It's not always comfortable, but it's very important. One situation with me is I missed a physical. This is years ago, but I missed one physical 1 year. When I went back the next year, I had a fibroid that was the size of a Cornish hen. And so just by missing a physical 1 year, that was on me. And I probably could have caught it the previous year. So I'm a testament to what you're saying. So I should never miss a physical, but I kind of got lazy during 2020, everything shut down. So it was kind of, so trying to crawl back out of that. So we're going to take right. Well, hold on to that thought. We're going to take a quick break. And when we come back, we're going to expound on that. And then we're going to also touch on the obesity medicine and the treatment of that. We'll be right back. Welcome to Trish's Treasures. This is where I share some of my favorite beloved products that I use on myself with you. Welcome to Trish's Treasure. One of the things that most people do at the beginning of the year is that we decide we're going to eat right, we're going to live right, we're going to handle our finances. And that is one of the things that I said I was going to do as well on this year, but I'm serious about it. So what I did was I decided I wanted to do a cleanse to start the year out correctly. I was blessed to be introduced to Tada's 7-day cleanse, which is amazing. You're provided a packet of, I want to say 12 pills that you take every evening or whatever day after a meal, because you're taking so many pills. But I took them after dinner, and it's 12 pills, and it cleansed me out completely. I just want to say that it doesn't have you running like some cleansers do. You will go because that's the purpose of the cleanse, but you just really, really feel clean and ready to just renew your whole system. And it wasn't just the physicalness that I felt better, but it made me feel lighter. And I know that was because I was dealing with a all new, whole new, clean liver, cleans everything. And I started the year out right. So this is definitely a Trish's Treasure, and it doesn't have to happen or occur at the beginning of the year. You can clean your system and start all over onto a healthier you throughout the year. Remember, Tada's Fitness 7-day cleanse. It is definitely a Trish's Treasure. Welcome back to Style with Trish. We're continuing our conversation with Dr. Devonna Anderson. And before the break, we were kind of touched on the importance of having our annual examinations and things of that nature. What are some of the most important tests that we should, if our doctors don't initiate on their own, what we should actually ask for and request annually?
So, a mammogram for sure.
Mm-hmm.
I've had, like I mentioned earlier, I had a woman who had a mammogram. 6 months later, she passed away
Wow.
because of an aggressive form of cancer that she had. But what I'm saying is things can change from year to year quickly.
Yeah.
So yearly, there are some doctors who are only saying, well, get it every 2 years. That's not my recommendation. Get your mammogram every year.
Mm-hmm.
Secondly, well, a pap smear is plus or minus, right? It depends on your age range. If you have a certain test that tests for HPV, which is human papillomavirus, which causes cervical cancer. If you have that, then you can stretch it out to every 3 to 5 years. Even in saying that, though, that test is every 3 to 5 years, but you still can get that pelvic examination where you go into the doctor and they check your ovaries, they check your size of your uterus and things like that every year. They don't differentiate that a lot, but you can still go to your doctor and request that I need you to check me out because that's part of your body. You know, that shouldn't be neglected. And like nobody's examining that every time you go to the doctor, that part of you. So your mammogram, your pap smear, your self breast exams, again, that's plus or minus. Sometimes you can't feel anything, but you know, it's still a good idea to just know what your own body feels like and what it looks like. Tests you should have if you're over 55, a lung and you smoke, a lung screening test with and CAT scan. If you've been smoking for more than 15 years. For men, a lot of us have men in our lives, prostate check. So encourage them to get their prostate check. For men who are 40 and above, prostate check for Black men, especially because it's more aggressive in Black men. And then lastly will be the colonoscopy. 40, I think for African Americans now it's 45 and above, but you know, I've tried to push it to 40. Because I know too many people who have gotten, who have had colon cancer, like early colon cancer, like in their early 40s. And so if you can get it sometime between 40 and 45, especially if it's in your family, especially, they can get it at 40. Every 10 years, every 3 to 5 years if you have a family history. So those are the things that are most important for you.
And what's your opinion on, for someone like me who has had to have a hysterectomy due to fibroids, female, being above 50, you know, how as far as their feminine checks. What do you suggest for that?
Just because you don't have a uterus, well, do you still have your ovaries? Like, question
Yes.
that. So if you still have your ovaries, when we do a pelvic examination, we check the size of the ovary. You still can get ovarian cancer. Even though there's no screening test for ovarian cancer, they don't have one developed yet. So it's difficult to find. Most of the time when people get ovarian cancer, it's at the later stages. So, but the one thing you can do is get a pelvic exam and have them palpate or feel for your ovaries. Also, you have skin down there. Like, who gets a mirror and looks down there every month or whatever, or every year to see what's happening? You can get vulvar cancer. You can get so many other cancers that are in your genital region that can cause issues. So, I mean, it's still a part of your body that shouldn't be neglected. So, in my opinion, you're a female, you should request for the genital pelvic examination like once a year, just like you would the rest of your body.
Okay. And you touched shortly on the importance of family history when it comes to certain things. For instance, whether it's diabetes or on my mother's side, the males, they've had issues with the heart. How important is it to kind of have those conversations with your doctors and letting them know the history? It may not affect you, but does that require different type of testing, or it directs how testing takes place?
It's probably one of the most important things you can do because it directs how it should direct. If you have a good doctor, should direct the way they treat you. For example, like I mentioned earlier, if you're a male, you have a family history of prostate cancer, and especially if you're African American, they need to start doing that PSA test early, like in their 40s. Or if you have a family history of breast cancer, depending on how many women in your family and how close they are, maybe you can get genetic testing. Maybe you can get a breast MRI. There are other things that can be done. For some women, they even have to get a prophylactic, they choose to get a prophylactic mastectomy. So they remove their breast because their family history is so strong. So it directs everything. Like if you have a family history of diabetes, so then your doctor should be talking to you about how you eat, cutting down your carbohydrates, how you move, checking your insulin levels, not just your blood sugar, checking your insulin levels, checking your hemoglobin A1C, checking those things to see where you are on the spectrum. Are you getting close to diabetes? Because we can tell people are actually usually like showing signs of diabetes 10 years before they actually are diagnosed.
Wow.
So
Okay.
if if your doctor's checking you all along the way, those different things, you already know when you're on the way and you can delay it. So maybe you won't get it, or maybe you won't get it until you're 80, or maybe you'll be more active, more prone to keeping your weight down because you know that you're prone to getting diabetes.
So say you have a diagnosis of something like high cholesterol or high blood pressure issues. There are individuals out there now who say, okay, well, I'll get on the medications because I want to get my numbers down, and I'll do the work when it comes to diet and exercise. Once you do those things, are there natural remedies that you suggest, or can they transition from the medicines into natural ways of managing those things?
I do manage my patients a lot with alternative treatments like herbals and things like that as well. But this is what I usually do. If they come to me just mildly like pre-hypertensive, like then I'll say, okay, well, use this beetroot, or use these different herbs or treatment supplements first and see if they help. Along with diet, and change your diet, decreasing your salt, exercising, weight loss. We do that for like 3 months. I give them 3 months. And then if it's still like trending upwards, then we'll start some sort of medication. So as far as the opposite scenario, if they come in, let's say their blood sugar, let's do blood sugar. Their blood sugar is high, like 300. We need to right away get you on some medication and get your blood sugar down, and initiate diet and exercise. And then once we see your blood sugar trending down with the medicine and diet and exercise, and you're really strict with your diet and exercise, then we can cut down on medications and slowly until possibly you can come off the medicines. But then at some point, it's a choice on how strict you need to be. You want to be with your lifestyle, how disciplined you want to be. sometimes it's so difficult to do those things. It's why the medicine is a help. It's like a bridge for you.
Yeah. And we were talking about this in the green room as I was getting ready. A lot of times our culture, we get caught up in, okay, well, I'm going to continue to eat how I eat, but then I'm going to pop my blood pressure pill, but still continue and that's not the way it's designed. Just kind of before we go into our next break, kind of break that down for us.
Oh yeah. Again, like I was saying, it's a discipline. Like your body is a self-healing. It wants to heal itself if you just help it out a little bit. If you eat good, I mean, you can't have, sugars that are teetering on high and then you decide you want to just take medicine and eat candy every day. It's just not the way it works. Like you have to help your body. It's a self-healing, or you're a self-healing organism. It wants to heal itself. It's doing all it can to heal itself, but you just have to help it. With food I tell my patients, food is medicine. Like what you eat, it totally affects how you feel, what happens in your body, your metabolism. It affects everything. So yeah, we have to help our body help itself.
Yeah, to heal. And not keep eating the way we eat and popping a pill and expecting that to be the cure.
Exactly. Popping pills and praying, talking about take the calories.
Come
out
on
the
now.
Actually heard that from your auntie.
Yeah. Yes. Well, we're going to take our next break. And when we come back, we're really this time going to dive into the obesity medicine. We'll be right back with Dr. Devonna Anderson.
Hi guys, it's Dr. Cassandra Evans, affectionately known as Dr. San, and this is your segment of Let's Learn Love. Hi guys, this is Dr. San, and I'm bringing you your Let's Learn Love segment for today. And today we're talking about when is the appropriate time to end a relationship. Now, one thing that I will say, covers any kind of relationship, whether it's romantic, work, or even somebody that's in your family. These things, when it comes to ending relationships, can be hurtful. It can be saddening, but you must remember you have to protect you in all circumstances. So what does ending a relationship look like, and why would we do this? One reason why we would end a relationship is when somebody is constantly crossing your boundaries. If you have had a talk with somebody and you told them about your boundaries and what you expect and what you don't expect, and they keep crossing your boundaries, one thing is that shows a lack of disrespect. And what happens with that is that means that they don't respect your wishes. So with any relationship, if somebody is not respecting your wishes, then that's a red flag. And you should consider that to be something that is detrimental to your relationship. Something else I will say that is life-ending for a relationship, so to say, is when the trust is gone. If you cannot trust that person, whether it's something simple as, getting you something to eat, all the way to, driving you somewhere or picking you up from somewhere, and you feel trepidatious about asking them because you don't think that they can do it, that's a real bad habit. And that also shows a lack of disrespect for you in the relationship. The last thing I would say is another major reason why to end a relationship is communication. Communication is very important for any relationship, and if they cannot speak to you in an appropriate manner without being disrespectful or hurtful to your feelings and your boundaries and your emotions, then that is something that you need to think about when it comes to ending a relationship. Because again, at all costs, we want to protect you and your being. So with that, what are some things that are what are some things that you would consider that you would end a relationship about? Please let me know, write, call, whatever you want to do to get in contact with me. And remember, this has been Dr. San, and this is your segment of Let's Learn Love.
Welcome back to Style with Trish. We are continuing our conversation on obesity medicine. Doctor, We have so many different things that's out right now. First of all, kind of explain the treatments that you do and how you approach obesity and how you treat your patients.
So I call obesity the mother of all diseases, all
Mhm.
lifestyle diseases. So if you treat obesity, then you don't have to have high blood pressure. You don't have to have all these other things, heart disease, diabetes, and all these. And so I treat obesity like it's a medical condition because it is
Mhm.
with medication,
Right.
right? So medication, number one, because once you lose weight, your body fights against you to try to gain the weight back. That's just the way our biology is. It does not want to be thin or skinny. It wants to keep the weight on that it had on
Mhm.
before.
Mhm.
And then food is the next thing. We focus on food, nutrition. Thirdly, we focus on physical health. Physical activity, not so much to lose the weight, but to help maintain the weight and to be physically healthy for
Okay.
cardiac health and, muscle toning and things like that.
Mhm.
So that's so medication wise, there, like you mentioned, there are a lot of different treatments, some
Mhm.
more efficacious than others.
Mhm.
Um, some are old, some are new. So the newest treatments that we have now are a class of drugs called the GLP-1
Mhm.
medications. They're actually hormones, appetite hormones,
Okay.
and that we make naturally. And so it's an extra boost of that particular appetite hormone that as you gain weight, your body becomes less sensitive to that hormone. But when
Mhm.
you inject it into your body once a week, it tells your brain that I'm not hungry. Like when you eat, but then when you get full, your stomach gets full, your brain tells you, okay, I'm not done. Just like somebody who's thin, how they feel when they're done eating,
Mhm.
they don't keep eating because it tastes good. I'm guilty. It's
Yeah.
called hedonistic eating. Like
Mhm.
it tastes good, so I'm gonna keep eating. I'm gonna override the fact that my stomach is full. But this
Wow.
particular medication, it doesn't let you override it. You feel nauseous or you just don't want it. The zing
Mhm.
is done for food. It just goes away.
Yeah.
So it's a very excellent. It works as well as weight loss medications.
Okay.
Weight loss surgery.
Oh, really? Wow.
These new medicines are like a life. That's why a life changer for so many people, which is the reason why it's on back order and we can't keep it. The manufacturers can't keep it in stock because there's such a high demand for the medications.
Mhm.
So yeah,
So that's a good one. That you said it was GLP.
yep, a GLP-1 medication. So they're different. Wegovy is the one that's out. It's a GLP-1.
Mhm.
Ozempic is the diabetes form of it. Wegovy is the weight management form of it. They're the exact same medication. So
Okay.
um,
And you take those together?
nope, two different medications. They're
Different. Okay.
two they're two different medicines, but they're the same molecule, but just two different names. The
Oh, okay,
one
I
we can
got you.
prescribe for diabetes and one we can prescribe for weight management.
Okay.
So I was telling you both because if you're diabetic and you have weight issues, should be on Ozempic,
Okay.
right? Your doctor should. But if you just have a weight issue, then you should be on Wegovy.
Okay, I got you.
The same medication though.
Now I heard something about a term called Ozempic face. And I'm sure you're familiar with it. What does that mean?
You know what? It's funny because I have a patient before I'd heard that term, she was like, I want to stop losing weight because my face is getting saggy and I'm losing the fullness, I'm getting wrinkles. So
Okay.
basically it's just losing a lot of weight quickly and your face gets thin and
Oh, okay.
saggy and that people don't like the way they look because they're used to that fullness. Because when your face is full, you look more youthful.
Yeah.
And so they're losing it and that's all it is. It's
Oh,
nothing.
okay.
It's just a rapid, people who have bariatric surgery, the same thing happens to them. They lose
That's
weight
true.
rapidly and their face changes, but they're just not used to it. People are not used to their bodies in general. They just don't want to lose that much weight sometimes because they're used to being bigger and everybody around them being bigger.
Mhm.
That's a
And you,
whole nother conversation. Me
yeah.
convincing people that you need to get down to your regular, like a regular BMI, a normal weight instead of being heavier because they're not used to seeing themselves like that.
And because I've heard people say, well, my head looks big now. Well, your head was always big. You just had big cheeks to go with it.
Too much shoulder fat. And I didn't mention another drug called Manjaro. That's the latest one. Manjaro works the best, better than all of them.
Okay.
So yeah, and that one is
How was that one? How was that one given?
all injectables. So once a week injections.
Okay.
Yep.
Okay.
Very difficult to get though right now. And Mounjaro is not for weight management. It's not marketed for weight management now. It's for diabetes only. So you can't get it for weight management, but they are developing their weight management version of it, which should come out within the next year or two.
Okay. Okay. And so when you're treating your patients that are on that, what does that treatment process looks like? Are you following them and monitoring them, and for how long?
It's a lot of so I have something called my practice is called Ahava Wellness. I keep my prices low because weight management is a long-term thing. It's not gonna be like 6 months or 3 months and the weight's gone and you're done with me. No, you're gonna be at least with me for like 2 years minimum.
Okay.
Because you need to lose the weight and you need the accountability.
Yeah.
Accountability that helps you to maintain and continue your current habit. I mean, your good eating habits and good nutritional habits, and exercise and so forth. So, yeah, we start the treatment, we continue, and we just follow you for 6 months. I see my patients first every week for a month. And then after that, it's once a month. And after that, once they maintain or get to their goal weight, it's once every 3 months.
Okay. Okay. Well, our time went by so fast. We might have to have you back for part 2 of this conversation. I might have to have you have a segment, but we'll talk about that offline. Thank you so much for sharing the information. And if anyone just has questions or want to inquire, about the weight loss journey or even the addiction part side of that, how can they reach you?
So my email address is Dr. Anderson at Ahava, AHAVA wellnesscare.com.
And we'll lead them your way. And thank you so much. And I'm going to follow up with you because I got a lot more questions, and we'll actually talk about coming back out on the show. But thank you so much, Dr. Anderson. Guys, that was Dr. Devonna Anderson. She's based out of Indiana, but she has an email address that is worldwide. So make sure you reach out to her if you have any questions or if you need any assistance just on overall health. But definitely if you're battling issue with weight. We'll be right back. Hi, my name is Trish Standley, and I'm the host of Style with Trish. Be sure to check our show out on every Sunday at 1 p.m. Eastern Standard Time on our new network, VTV Network. All you have to do is download the free app, and you can view our show on Amazon Prime, Roku, Apple TV, as well as Android. Be sure to check out all things Trish at trishstanley.com. Remember, this is the place where the everyday woman reigns.
Every day a woman reigns. Every day a woman reigns.
I'd like to thank my guest, Dr. Devonna Anderson, for hanging out with us. I still have so many questions, so we're definitely going to have her back and possibly give her a segment, hint, hint. But at any rate, I loved what she had to share about the importance of getting our annual checkups. It's so important. It isn't just for our well-being, but also our family's well-being, because if we take ill, they will be the ones who have to care for us. But I also like what she said about the losing of weight and dropping weight the healthy way and being guided by a professional. I love that. So if you find that to be a struggle in your life, make sure you reach out to a professional and get some guidance in that particular area. All right. I love you. We want to see you around as long as possible. Thank you for joining us. And as always, love isn't love unless you give it away.
Hang on, though you